Hello and welcome to another series of lectures about ultrasound physics. And in these lectures, we'll discuss the transducers. Transducers could be also called probes, could also be called scan heads or scanners. In this series of lectures, we'll discuss the basic components of the transducers, the non-imaging transducers, and the imaging transducers. Non-imaging transducers. There are many types of non-imaging transducers that they are not doing any imaging in the ultrasound field for the medical application. The first one is the industrial, which is used in the industry, not in the medical field at all, for metals, metal welding, and all these applications. The second type of non-imaging transducer are used in the medical field, but not in the imaging. They are in the therapeutic part. Therapeutic applications like physical therapy, crushing of urinary stones, and this is called endoscopic lithotripsy. They put a specific probe with a very long metal tip that can go inside to the ultrasound to the stones and disintegrate the stones. Another one is called the HIFU. This is a high intensity focus ultrasound. This is used for tumors fulguration. The last one, and this is the one we'll focus upon, is the continuous wave and the dedicated type of continuous wave probes. They can bring no image, but they are used in the DMS for the Doppler application for vascular, but it's not in the field of getting an image. You can get only a waveform. The dedicated continuous probe is for the waveform. It does not bring an image. A diagrammatic picture of the dedicated continuous wave transducer. It's good to mention that the continuous wave application in the medical ultrasonography can be performed by one of two methods, either the dedicated continuous wave probe, which is this one that has two specific crystals, one for continuous transmission and the other one is for continuous reception. And this is the commonest one that will be mentioned if you have in the exam something about the continuous wave. Think of this one. But there are other application of continuous wave that can be done through the array transducers. Array transducers are made of multiple crystals. But how they do the continuous wave application here, they assign two crystals, one for continuous transmission and the other one is for continuous reception. And in this way, they can have continuous wave application in the array transducers. And you can see this in the console of the ultrasound machine, that you see that there is CW. CW means what? This is the one that is being used. But in the again in the board exams, if you have a question about the continuous wave, they mean mainly this one, the dedicated continuous wave probe. So now we come to the CW dedicated probe, sometimes called the PEDOF probe or the blind pencil probe. It's commonly used in the echocardiography. This probe is made of two what? It's made of two crystals, one that is continuously transmitting, so this is the direction of transmission, the red one, and another one that is continuously receiving, and this is the reception direction here. In between these two directions, there is an area of overlap. So this overlap area, if any movement here, it will be displayed on the screen. Movement here away from the area of overlap doesn't show. So this overlap, it acts as a big, as if we have the sample volume in the pulse wave. It acts like as if there is a sample volume, but this sample volume here is huge. As you see here, it can accommodate one or more vessels in the area of overlap. Okay, so how can I adjust the angle then? Because I don't have an image. This is non-imaging probe. Okay, it's not pulse wave, it's a continuous wave. So I have no image here. How can I adjust the angle to be 60? By adjusting the angle of the probe to the skin to be 60, because most of the times the vessel is parallel to the skin. What are the components of this CW dedicated probe? Okay, like I mentioned earlier, if somebody asks about the CW in the exam, this is the one they talk about, the dedicated probe, not the CW activity in the array transducers. Unless they, like I mentioned earlier, unless they mention clearly about the CW activity in the array transducer. But if they just mention CW, this is the one. Okay, CW probe is not imaging. We can't get an image. It's only spectral waveform. Only spectral waveform. Again, CW brings me only spectral waveform, no image. That's why you get it has some limitations in its use. So what are the components here? The components are we have two crystals. They are head here in the head. They are two crystals here, one for continuous transmission and one for continuous receive. There is a matching layer. Of course, there is a matching layer like any probe, but there is no damping layer. Okay, so this transducer has two crystals, a matching layer, but no damping layer. Why? Because I don't want to damp the transmitted waves. I want them to be in a continuous transmission. Since we don't have a damping layer, so there is no imaging. It's non-imaging probe. It's a narrow band. It's a high Q and high sensitivity. All of these like come with a bundle. As far as we have no damping layer, I will have these come as a bundle together. Okay. The probe frequency here is determined by what? We have here, like I mentioned, there is a PCT that's located here that continuously transmitting. Okay, at which frequency is transmitting the waves is because of the frequency here is determined by what? Determined by the electricity delivered from the transmitter or the pulsar of the ultrasound system that is delivered to the CW crystal here. So this frequency, the ultrasound frequency, is determined by the electric frequency. How the received echoes are processed. The received echoes or the received Doppler shift is processed via the fast Fourier transform. Same technology that is used in the pulse wave, fast Fourier transform. Okay, the CW Doppler tracing will be demonstrated as a spectral broadening. Why? Because we mentioned that there is a wide sample volume or the area of overlap. This area of overlap is sampling all the velocities, almost all the velocities of the vessel. So starting from the very low velocity to the very high velocity, all of them are sampled. I will get for sure there is spectral broadening. And this CW probe, because it has no listening time, so all the Doppler shifts are processed, and I will not get aliasing at all. So there's no aliasing, there's spectral broadening, and the technology used is the same as the pulse wave, which is the fast Fourier transform, FFT. So what are the benefits or the advantage of the CW? Okay, there is no aliasing. This is the one famous thing about the CW. Why there is no aliasing? We mentioned earlier that aliasing happens when they have the Doppler shift is higher than the Nyquist limit. If I'm increasing the PRF, what happened? The Nyquist limit is increased. If I have more increase of the PRF, so I'm having more pulses, very rapid pulsations, I will get, for example, thousands and thousands. And then we come to the point that I have a continuous stream. When I have continuous streaming, that the PRF is almost infinity here. And this infinity means that the Nyquist limit is unlimited. So there is no Nyquist limit. And that's why I will not get aliasing, because whatever the Doppler shift is, it will never be beyond the infinity. Okay, so it can display all the velocities, all the high velocities, and also it can display the lower velocities. Why? Because no damping layer, so that the received echoes will not be damped as they are received. So I can get also the lower velocities. So the extremes of velocities will be detected easy by this probe. Okay, again, we have a small footprint, and that's why many times it's used by the echocardiography. It's not expensive, and we all know that Sometimes it can be manufactured as a separate device, have only the CW activity. So what is the limitation now? So we know that the benefits. The limitation is that since I don't have a pulse wave, I don't have a listening time, I don't have an image. So no imaging. And since I have no image, I cannot put the sample volume at any segment of the vessel. I cannot tell which vessel is being scanned unless I know by anatomy. But I cannot tell which area that is being scanned by this probe. So this is there is what we call range ambiguity. Again, remember that we are talking here about the dedicated CW. We are not talking about the CW in the array transducers, because in the array transducer, some of these limitations are overcome. Okay. So again, we are talking about the dedicated continuous wave. Okay. And again, I have a narrow band of frequencies. As we see here, there is some this table or comparison chart between the pulse wave and the continuous wave. Pulse wave, this is the array transducer, most of us know it, and they can transmit the Doppler pulse. So this pulse wave transducer can operate with minimum 1 crystal, right? Spectral waveform and color range resolution. So in the spectral waveform and the color, okay, there is a range resolution. What does it mean? It means that I can see where the artery, where the vein, where the flow here, what is the if I have the depth, at which depth. So there is a range resolution here. Okay, it has a limited maximum velocity, which is the aliasing. Okay, beyond this, I will get aliasing. This probe, or this the pulse wave probe, it is as we mentioned earlier, it's an imaging transducer. It's damped, and that's why it has a low Q. It's a wide band of frequencies, low sensitivity, all the drawbacks that come with the damping of the transducer. We come here with the continuous wave. Continuous wave, this is we mean here the dedicated continuous wave. Again, we are not talking about the continuous wave activity in the array transducer. We're talking about the continuous wave probe, which is the dedicated one. Okay, it can operate only with have 2 crystals. We cannot operate with 1 crystal because 1 crystal is either transmitting or receiving. I can't have the same crystal doing the 2 jobs. Again, there is spectral waveform only. We can't have an image, so there is no anatomy shown in the screen. That's why I get range ambiguity. I don't know where the vessel is located exactly. I don't have an image. Okay, unlimited maximum velocity, as we see here, because there is no aliasing. I have almost infinity or non-limited Nyquist limit. So there's no limitation actually for the Nyquist. There's no damping. That's why I have no image. There's a high Q, a narrow band of frequencies. Thank you, and we'll move forward to the imaging transducers in the next series of lectures. Thank you again.